Hi and welcome along to AFTV. I am back with another video with the legendary Dr. André in the building. Great to see you, Dr. André.
Cheers.
In this video, we are going to discuss Mikel Merino's foot injury. What's going on with this and how long Dr. André thinks he's going to be out. Also, we're going to talk about Kai Havertz. How do Arsenal manage his minutes now that he's back from that long-term injury, scoring goals and doing well, but how much do we play him? We're going to discuss this with Dr. André, of course, who used to be a doctor at Everton Football Club, knows all about managing players and being a doctor. And he's still a doctor. He's just done some great things with me, with the supplements and that stuff. And I know you're doing some new stuff at the moment as well, aren't you?
Well, yeah, well, when we did your bloods originally, we got loads of really great data about your metabolic health and metabolic risk. And from that, we designed a program from there to get you fit. And I was thinking, well, we can offer the same thing nationally to anybody watching that wants a bit of Dr. André to help them through that journey. We can do a blood test anywhere in the country for them. They go for the test, I get the results, then we can do a video consultation chat to work out what we can do next and design a plan for them. So if anyone's interested in doing that, just get in touch with us here.
Yeah.
We can do, so you don't have to come to the clinic in Alderley, in Cheshire. We can do all those things virtually and sort of start you on a really good health program of metabolic health and fitness.
So they just go into a local place, get an injection,
The
blood.
The blood can be taken from a local place. They're everywhere, Superdrug, Randox, loads of places. So if you're in Glasgow, if you're in Cornwall, if you're in London, if you're in Birmingham, there's a place we can send you to. You go for the bloods, they come to me, the results. Then we have a virtual chat, half an hour consultation, go through it, break it down. Where are you strong? Where are you weak? What do you need? Supplement, medication? We can organise all those things for you as a consultation.
Wow. So blood really does tell you a lot about a person.
I mean, it's almost endless. The book of blood tests is like a Bible. It's that thick.
Wow.
But there are basic fundamental ones that we all need. Things that help us with diabetes risk, with lipid levels, inflammation, kidney, liver function. So these are the real crucial ones, and that's what gets covered in the blood test. It's very, very detailed. Not a test you get from your GP, way more detailed, and we go through it, real fine-tooth comb to work out what's best for the individual.
Okay, that's amazing. All right, so we'll put a link in the description if you want to get that done. People shouldn't be scared of blood tests, should they?
No, it's nothing at all. It's nothing at all. All we do is find out good stuff.
Yeah.
Useful stuff.
All right, brilliant. Well, we'll put a link in the description. If you're interested in that, you can get in contact. And I know for a fact in doing that, that's where he started giving me loads of warnings. Robbie,
I'll be gentle.
Stop doing this. You need to stop doing that. But it worked. It worked. And I'm really, really grateful for it. But we're here to discuss football. Arsenal fans found out the other day that one of our best players, like Mikel Merino, who's been brilliant for Arsenal. Last season, when we were suffering a load of injuries, round about this time actually, he came in and it was really his goals that really helped us. We didn't sign anybody. And he came in as a striker and he was absolutely brilliant. And this season as well, he's been a really important player for Arsenal. He's also been a really important player for Spain, scoring lots of goals for Spain as well. But we found out a couple of weeks ago that Mikel Merino has sustained a foot injury. That's what they said at first. He was missing in a game and we was thinking, well, what's up? Well, he seemed fine. He's been playing. Well, what's wrong? Only for us to find out that it looks like it's a fracture that he sustained. And the way they reported it on Arsenal's website is that literally he's going to be out for the season because they said, we're hoping that he's going to be back before the end of the season for for rehabilitation sort of, which also puts in jeopardy his chances of playing for Spain in the World Cup. It must be really devastating for him. But what is this injury? What is this injury that he suffered, and why is it going to keep him out for so long?
Yeah. So as I understand, they've described it as a stress fracture.
Stress fracture.
Yeah,
that's right.
yeah.
What is a stress fracture?
Yeah. Well, first of all, what is a fracture? Okay. So a fracture, importantly, is the same as a break or a snap. Okay. They're all the same thing. They come under the heading fracture, whereby there is a loss of the normal integrity of the bone. So the bone should be this solid structure, all held together. When there's a break in the continuity, that's called a fracture. Now, normally the fractures you think of are ones that involve some sort of explosive injury. There's huge trauma, high force, and something cracks or snaps. You get the like a shin, wrist. These are the most common ones, aren't they? So the way a stress fracture is different is it is still a fracture, but it tends to be small, and it's not caused by one huge explosive event. So you'd know it happened, like you've fallen over, something buckles, oh my God, that's painful, it bleeds, it swells, I've broken my arm. This is much, much smaller. It's almost like a micro damage to the integrity. So you don't feel it like a massive pain. It just sort of gives a bit. And a few of the areas of bone just sort of break down. Now, when they crack, there's a special cell in the bone that basically eats the bit that's broken. Okay? And when it eats it, it then lays down new cells to make it new bone. So old bone that's cracked is eaten. Okay? New bone is laid down. Now, that's the same as every fracture. If you get a big break in your arm, it breaks, there's a massive overgrowth of bone that then remodels. The issue with a stress fracture is because it's small and you hardly know that it's happened, what you don't do is rest because you don't know it's a fracture. It's so subtle. And the area remains irritated. So it's dissolving the bone, laying down some new bone, but because you're not resting, the new bone doesn't settle. And it then separates again. So it dissolves more bone, more is laid down, you don't rest, it shifts again, and it keeps happening over time. So gradually you get an increasing crack in the bone over time. And it's caused by some repetitive stress, some imbalance, excessive force, bad footwear, poor posture that's putting excessive load on one zone of the bone. Now, let's say he wouldn't feel this straight away where you would a broken ankle. He'd feel a niggle, a little nudge, a bit of pain. But then as the days go by, weeks go by, months go by, it becomes more intense. You can't.
So you could have had this injury for a while.
Yeah, absolutely. Because if you X-ray the area, you don't see it because it's so small. It doesn't really show up. You'd need more detailed imaging. So you might need a CT scan or an MRI scan that would actually show a change, not a big crack, but a change in the way the bone is looking in terms of heat signal and slight swelling. So they're very, very subtle, and normally they just go unnoticed by the player until it reaches the point whereby the crack has got so far it's causing genuine pain, and every time they move it's sort of splitting each time, and then it's a problem because to heal it, what do you have to do? You have to rest, and often rest completely. But because it's often a complex injury, not quite the same as the regular fracture, the recovery is slower. And all you can do is slowly reload after a period of rest. So we're talking, in this case, and normally in the foot it's the navicular or the fifth metatarsal, these bones whereby the blood supply isn't great. It's one of the reasons why it happens in the first place. The crack, poor blood supply, and then suddenly you've got a long-term issue. So since he's out for the season for that reason, that they're going to rehab him, but there's a rest period of doing next to nothing, let it sort of stick, and then gradually reintroduce forces so as not to overload a fracture, which has been there probably for weeks or months.
Wow. So that's why, because we were all just like, it's all of a sudden, what now? This guy's been playing, and one of the things is that actually that a couple of fans were saying is like, they picked this up, but what you're saying now explains it.
Yeah, in the early doors, they are incredibly hard to pick up. You can X-ray scan these things. It will just look like a little bone bruise. So if the bone isn't broken, you can do an MRI, and it will show a bit of edema, a bit of swelling in the bone marrow. That could be a knock or a clunk or anything. But then, would you scan and X-ray somebody every single week to see where it goes? You probably don't. And so they are always easy to miss.
It's probably his pain level went up.
Yeah, he would have reported that. He'd say,
yeah.
This pain is just now, it's there all the time. And it's like, oh, okay, well, X-ray, can't see much. CT, a tiny little line. MRI, oh, there it is. The bone's sort of white. I sent you a picture, actually, last night.
Yeah.
And as a scan, you can see there's like a white hot zone of white within the bone itself.
We'll
it should be clear.
We'll have to post that picture up so that you guys can see, like, it does really explain.
Yeah.
So listen, you've explained that brilliantly, and that's exactly why he's out. And so you think out for the season then?
So where are we now? It's sort of Yeah, I mean,
February?
Yeah, I think it'll be a month's recovery. I mean, several months recovery for this. So it gets us into when you're into sort of 6, 8 week, 10-week territory.
Right.
We're getting towards May, aren't we, in terms of the end of the season?
So has he got a chance of making the World Cup though? Because the World Cup is for June, mid-June, July.
Yeah, it's possible. It's possible. It's possible. But there's no guarantees. Depends on his progress, recovery. When he's reloaded, does it maintain? Does it set nicely? And then you'll get fit for that as well.
How can he pick that up then? Maybe just a tackle or someone stepped on his foot. It could be anything.
No, it's not normally something as dramatic as that. It's normally just a subtle shift whereby there's just a tiny bit more load than the bone can take. Let's say footwear. So the footwear puts abnormal load on one part of the foot. And week by week, the stress is there, and then one day the stress just slightly overwhelms the bone, just a little bit. What happens? The bone, because bone is not like muscle, okay? Muscle, you have the same number of muscle cells as I do, okay? The same number as Arnold Schwarzenegger, okay? Okay, we all have the same number of muscles, and we never ever replace them. The muscles you have are the muscles you're born with, and you never get any more, never get any less, okay? You have this certain number. So muscle never changes. So it's very well designed to heal rapidly because you're never going to have more muscles. Bone is completely different. The second bone is damaged, the body gets rid of it. It eats it and throws it away and makes new bone. And that's why these recoveries are always so much slower. So get this tiny defect, a bit of absorption of the old bone thrown away, new one laid down, but then if the same forces are there, it just can't set. So it weakens and then eventually the crack appears. So one part of his recovery will be, why did this happen? What is it about load bearing, gait analysis, running technique, posture, footwear that might have contributed to it?
Wow. Thanks for breaking that down. I mean, we've also, on the good side of it, we've got a player that's come back in Kai Havertz, out, long-term injury, his knee. He's had a couple of injuries, but the latest one kept him out. He got injured the first game of the season against Manchester United. Yeah. Only has just returned recently, but listen, starting to look good. Scored a massive goal when we beat Chelsea to win us that semi-final and get us into the final of the Carabao Cup. We're all excited to see him back, but how do they manage his minutes? Pressure's on already. I hear a lot of fans saying, right, start him. Yeah. Havertz should start. But so far, it looks like they've been managing him. He's been playing a half here. I mean, even the game against Chelsea, he came on like last 10 minutes. Do you envisage that's what they're going to be sort of doing with him? Or is he ready to start now? Is he ready to start following this injury?
I guess there are 2 points I make. One is, this is perfect for all the AFTV viewers now. They can take this to the pub and use this little phrase, okay? Football is a game of two
halves.
Yeah, okay. When you're injured, it's not, okay? It's a game of one half and 2 quarters, okay?
And 2 quarters?
Yeah, that's right, yeah, okay.
Right.
This is crucial, okay? So because he's not been playing, he's not sort of what we call match robust. He's recovering, he's returning. You have to see it as being there's a half he could play, but the second half, after having a break and then returning to action second half, is really in 2 pieces, okay? There's the bit up until just maybe 65 minutes, and the bit after. Now, the difficulty when you return from an injury, and this is the same for anyone watching, is you may be fit in terms of your muscle strength and range of motion, but the complex neuromodulation, proprioception, joint position, the brain part of recovery is the last thing to kick in. And as you get tired, that is the weakest part. And that's the bit that normally saves you from being injured, is the brain being able to get you out of a difficult tackle, do something clever to protect you. And that's the bit you're missing when you first return to a game. So what they're doing here is they're respecting the fact that the first half is fine, the next quarter is okay, but the last quarter is the danger zone, okay? And 2 to 6 weeks after a return from injury, your greatest danger is in that last 20 minutes where you are simply fatigued. You can't, I said before, you can't recreate the stress of a game in training. It just cannot be done, Okay, the noise of a crowd and the intensity and the push, you can't quite recreate it. So I think it's ideal to do it this way. And
Slowly.
It's just, it is a blend in that way. Because fitness is a complex thing. We've maybe said this before. As a doctor seeing somebody, there's a point where they're medically fit. Okay? All the scans are fine, there's no pain, they're medically fit. Okay? But they're only medically fit to then become training fit. So then training fit is next. And then the training goes by, and then you are then match fit. But you're not match robust. Okay? And the idea is that after a few games, you've gone from being match fit to then match robust. And that's where they want to get him to, and that's the little phase they are managing. And in the ideal world, that's what you do. The problem is, and I've been in teams which are fighting, scrapping for relegation, they go from being medically fit to being shoved into the game because such is the pressure sometimes. And that's when you wind up with recurring issues and you leave yourself very vulnerable to having a chronic long-term issue. But this is almost the ideal way, I would say. He's gone from being medically fit, training fit, now match fit, not yet match robust.
Yeah.
And they're obviously just working on him, getting him back to that. So I imagine another week or so should be fine to start and finish.
I mean, one of the things I've noticed with Arsenal this season, what they've been doing is because of the size of the squad now, they've deliberately gone out, obviously, and brought in a big squad of players to try and manage the massive volume of games that we play. But I've noticed that a lot of times players are out of games and the manager will describe it as he had a niggle. So we took him out. So is that the good thing about having a big squad, that, you know, if a player feels anything, because, you know, Mikel Arteta and the medical team over the years have been criticised for overplaying players, for playing players when they've got injuries or when they've got niggles. But it seems like this season they're not risking niggles. If someone's got a little niggle, we saw with Saka the other day, he had a little niggle in the warm-up, out you go, you're not playing. In comes Noni Madueke, able replacement. You think that they've deliberately, you know, that's a policy. Because with niggles, if you overplay those, I mean, it's a risk.
That's right. So if you ignore your body, anyone at home, if you ignore your body when you go and train or do your sport, your weekend sports, you can pay a price for that. The body tells you things for good reason. It was always the dream situation for a doctor in a club is that if someone had symptoms, you would then remove them from the situation, let that resolve and then go back. That would be the perfect situation. So could it be that they have found almost like a perfect formula whereby we have enough bodies, whereby we can then rotate in a way that doesn't disrupt the way the team plays? Because that was always the key. It's just once you start to rotate, do you lose the secret spice that's got you to where you got to? And from a medical point of view, I'd always thought, no, it would be better just to keep the players fit, because when it comes to the crunch time late in the season, the more fit players, you become rich, because normally everyone's just hobbling till the end of the season. And I mean, the Super Bowl is on Sunday. Almost everyone's injured. You know, they say when you meet an NFL player, never shake his hand hard, okay, because he's already got 3 broken bones in his hand by the end of the season. So that's not great. But they'd love to be as fit as they were start of the season, going into the last game of the season. So could this be the perfect thing to do, which is to listen to people's bodies and rotate? I think it probably is.
It looks like they're listening to the medical team at Arsenal at last, which is great. But Dr. André, thank you very much for coming in today. Once again, you've reminded us about you've told us about these new blood tests, the supplements. Everybody asks me about them all the time. I've still take them religiously. Just remind people where they can get those as well. Yeah,
sure. So from the Oxford Natural site, get those. The key is consistency. Okay, supplementation is amazing. It needs to go hand in hand with a change in your identity to eat a bit better, move a bit more, and accept that change happens gradually. And supplementation to help you with more energy, sugar control, and better sleep is the link where it links them all together. Your new behaviors, your new outlook together. So from Oxford Natural, optimum day and night, absolutely ideal for making a change to your health, better metabolism, better life all around.
Thank you very much. Thanks, Dr. André, and thanks to you guys. And if you want any more information, there is a link in the description. And we'll see Dr. André back again very, very soon.